Planet Vero Studio is powered by the Nolan Group of eXp Realty.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
Good afternoon and welcome to Community Conversations. As you've just heard, Treasure Coast Community Health has 8 different locations, and we have lots of caregivers to take care of your primary care needs, whether they be medical, dental, behavioral health, help with a discounted pharmacy, vision services. We try to make it very great and convenient for you. But we can't do it all alone. As you've probably figured out if you've listened to our program before, we have lots of great community partners. And so today, I'm thrilled to have one of those that you might not think about or even hear much about, but they are very, very important to the care of our most vulnerable in the community. And their executive director, Robbie Robinson. Hi, Robbie.
Hello, Vicki. How are you today?
Absolutely fantastic after nice long Labor Day weekend. So no laboring.
I need to correct my title. As of September 1st, I am now the associate director because starting September 1st, Jennifer Jones became the new executive director.
And I'm sure you're going to tell us a little bit more. Does that have something to do with phasing into retirement plans?
Well, I've agreed to stay on to support Jennifer until the 1st of January.
Fantastic.
When I will retire for the 4th time.
Well, I understand it's pretty hard to retire permanently. So good luck in your next career come January, whatever that might be.
Yeah.
Even if it's the go for a house husband, right?
Well, it may be that. I'm learning to cook more, but I think I'll stay on the board for the We Care Foundation.
Wonderful. Well, why don't you tell us a little bit about the We Care organization,
Good.
How it got started, and it's WECARE, We
Correct.
Care.
Mm-hmm.
Okay.
So 32 years ago, the County Medical Association, the Indian River County Medical Society, came to Dr. Dennis Saver, who was a primary care physician in our county, and asked him to form a group that would take care of those people without health insurance. Dr. Saver, who pretty much knew everybody in town, leaned on a few people and formed a committee, and they started the We Care program, which basically meant that if you had no medical insurance, you went to a primary care physician who made a referral to We Care. We determined your eligibility financially, and then assigned you to made appointments to a specialty doctor. So that's been going on for 30 years. As of today, We Care has 3 different parts. Number 1 is the Indian River County Medical Society, which is our parent organization.
Okay.
Made up of about 100 doctors in the county. And then the next part of that is the We Care Medical Program, which is the way that we connect people to doctors. We do eligibility and referral, and then assign them to and make appointments with doctors. And the third arm, if you will, of the of We Care is the We Care Foundation, which raises the funds to support the medical program.
And when you say that, I just want to be real clear here, because I've been so impressed with the number of physicians who have donated their time. They're not paid for that. When you talk about supporting We Care, it's for things that they need.
Good. We have currently over 100 doctors and their staffs who give a gift of service, meaning that they give their time, their expertise to patients without health insurance.
Okay.
But we don't want this to be a financial burden for them. So if, for example, you went and had cataract surgery done, We Care would pay for all the related costs.
So the eye drops and things like that?
Correct. The Avastan, and the medical doctors, or in this case, the ophthalmologists, dedicate their time. Often their anesthesiologist or their RNs also dedicate their services. But if they don't, We Care Foundation is there to pick up the expenses.
And I haven't had cataract surgery, knock on wood yet. But lenses are also required then?
So let me give you an example. We get a referral from a primary care physician saying we think this person needs cataract surgery.
Okay.
We make that referral. Let's say we make it to New Vision Eye Center, which is one of the practices we use.
Participating groups. Okay.
They then come in, and even though they've had some testing done, preliminary testing, through the VNA or through GlobeCheck, perhaps, with TCCH, even though they've had some preliminary testing, they come in for 2 appointments for testing and screening, and then they do the one eye at a time, and the surgery takes 5 minutes. It's a local anesthetic.
Oh.
And then they come back like a week later for a follow-up. So there's really 4 visits involved.
Wow.
And so if you think of the time and the personnel involved, it's a pretty big expense.
Yeah.
So we estimate about $550 per eye for cataract surgery that We Care underwrites, and the other practices like New Vision pay all the rest.
That is fantastic. And you say there's over 100. So does that mean that if a physician is part of the medical society, then they're automatically part of We Care?
That's a good question. They're not. I'd say 80% of all the members of the medical society are also We Care volunteers. And conversely, about 80% of the members of that volunteer are members of the medical society. But it's not one doesn't necessarily follow the other. We invite them to be a volunteer. We invite them to be a member of the medical society. Okay. And the good news is we've increased our membership in the medical society from about 70 2 years ago to over 100 right now.
That's nice. And I would imagine that the goals and the camaraderie help them as they come in new to town, perhaps through Cleveland Clinic. It's a way for them to socialize as well, because there's not a lot of time for that during a normal day. And
young doctors come in, and their first priorities is their family and their profession. And so we invite them to quarterly meetings that are more social events than they are business meetings. So the typical meeting would be like we're doing this Thursday at Quail Valley. Our doctor's invited, and they bring a guest. We have a social hour for an hour, and then a half-hour business meeting.
Okay. But it is not to include nurse practitioners or PAs unless they're invited by their doctor.
Correct. Okay. Although we do have PAs and RNs who are members of the medical society along with the practice with their doctor.
Okay.
Right.
So what kinds of things do you find most requested?
That's a good question.
I try.
Yeah. What we've been doing now with the We Care medical program is when we find areas that are requested a lot where there's backup, we run clinics.
Okay.
So in the next few weeks, we're having a GI clinic, and I'd advertise it now, except it's already filled. Through our collaboration with Treasure Coast Community Health, they've helped us find patients who are eligible. So Dr. Yakov Gittin, will be doing a gastroenterology GI clinic.
Okay.
And then Dr. Tudor Screeden, who's a cardiologist, will be doing a cardio clinic. Again, that one's all filled. However, we do have one that's open. Saturday, December 3rd, we're doing a dermatology clinic. And later on, I'll give a phone number you can call to sign up for that.
Okay.
It's a Saturday morning from 8 to 11. Eligible patients will see Dr. Jonathan Brow, and our nurse, Angela, will be there to assist him.
And Dr. Brow just did a dermatology clinic recently, didn't he?
2 weeks ago on a Saturday, Dr. Brow did our first clinic at the 787 TCCH 37th Street facility, and it was very successful. It's a nice partnership. We had our We Care nurse, and we had the receptionist and person coordinating the appointments was a TCCH employee.
Well, we're happy to do whatever it takes to make sure that people receive the care that they need. Right. And getting a specialty appointment is really difficult if you don't have insurance. You know, the reality is that there's a lot of paying customers, there's a lot of demand for specialists, and it's really difficult for the office staff to figure out how to balance it. So they sometimes are just the gatekeepers.
Well, and some good news is that in the past, we thought We Care could only handle those people without health insurance. We've now learned that if they have basic health insurance but don't have dental or vision, We Care can help them.
That's wonderful.
So if somebody comes to the TCCH dental clinic and sees somebody there, and it turns out that they don't have dental insurance, We Care can help.
Oh, that's wonderful, particularly for larger things like dentures.
Yes.
You know, we need to talk more about that. That's a really good thing.
Good.
And in the past, you didn't run as many clinics as you did individual appointments, correct?
Correct. In the past, we only ran occasional clinics if there was a backlog of patients that Cleveland Clinic couldn't handle. The county hospital district trustees want people to be seen within 30 days. And you know that if you and I tried to get an appointment with a doctor, it would probably take us more than 30 days.
Yes, it would.
But it is a worthy goal. But given the shortage of physicians, nurses, and staff, very difficult to get that done. But through Nurse Angela, our patient advocate, through her efforts, we've been able to get people appointments within a week or two.
That's amazing.
It is amazing. But again, it's those personal connections. Angela can call Faith over at Vero Renal and say, we have somebody who needs to be seen immediately. And then it turns out that person had kidney stones, and we had to then get a urology appointment. So it's really gratifying for me to help people.
Dr. Saver must be smiling down on us from heaven. Yeah. We're going to take a short break, a word from our sponsors, and then we'll come back and we'll talk a little bit more about some of the specifics of it.
Great.
Many women forego their own health care, giving their time to family and friends. And some forego health care for financial reasons, with not enough income for basic necessities and their own medical needs. I'm Vicki Soule, CEO of Treasure Coast Community Health, and I'm giving in honor of my mom, who taught me the value of early cancer detection. Join me in gifting healthcare to women. Visit tcchinc.org and donate to honor the women in your life.
You can trust Sandpiper Pest Control, serving Indian River, St. Lucie, and Brevard. Certified by the state of Florida to treat homes, lawns, and termites. Fully licensed and insured. Priced right, effective, and friendly.
Hi, this is Joel, the owner of Sandpiper Pest Control. Sandpiper can solve your pest issues. No contracts to sign, just results.
Call for a free estimate, 772-589-0204. Sandpiper Pest Control, a member of the iTex trading community. Your iTex dollars are welcome.
I love that I can sit in my car and wait for my appointment to renew my driver's license. No more lines, no hassle. Hey, I made my appointment online and it's going to alert me when it's my turn. Gotta go.
Hello, I'm Carol Jean Jordan, your tax collector here in Indian River County. To help you get in and out faster, we are introducing our new customer service system. Here, you can make appointments, check in remotely, or choose to wait in your car or in our lobbies. You can access this system through our website, irctax.com, and we look forward to seeing you.
iTex, or International Trade Exchange, is the largest barter company in the world, with over 25,000 members offering goods and services. We're a marketing company that brings you new business in the way of trade, with over 200 local members enjoying the benefits of iTex, like lawyers, doctors, plumbers, media, printing, and more.
Hi, this is Liz Bowler. Contact me and find out why barter through iTex has been smarter for over 30 years. 772-532-1881. Visit itex.com.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, which offers primary, medical, dental, behavioral health, pharmacy, all the general things that you need from birth to forever in terms of staying healthy and living an active lifestyle, as active as you want it to be, for yourself, your family, your spouses, your best friend, your mom and dad. So if you do not have a primary care physician, if you are one of the lucky ones that's seeing specialists, think about a visit with a primary care provider so that they can help you coordinate and bring you information about bettering your lifestyle from that basic level. Today I have with me Robbie Robinson. He is the Associate Director as of September 1st for the We Care Group, Foundation, Medical Group, and a branch off of the Indian River County Medical Society. I got it. All three parts.
Good.
But Robbie, when we were talking earlier, you mentioned the hospital tax district and how they have been a part of this growth as well. How are you funded? Do they carry all of the extra supply costs and things for We Care?
The Indian River County Hospital District has been very generous in supporting TCCH for many years and We Care. In the last 18 months, We Care has moved in a different direction. And right now, the county hospital district is funding all the expenses that go with our clinics.
Wonderful.
So, for example, we had a dermatology clinic a few weeks ago, and I think we had $2,500 worth of supplies that we needed to order. But we can now use those supplies probably the next 3 or 4 clinics. We send an invoice then to the trustees, and they fund that.
That is wonderful.
And,
thank you, trustees.
Yes. And they're also funding, at $550 an eye, they're funding $20,000 worth of eye surgeries. So that's 3 or 4 a month. And when those funds run out, we can ask them for more money. And if it's available, it goes directly to patient services.
So one of the things that I was remiss in, if you have just joined us and don't know much about the We Care organization, besides the fact that it has 3 separate kind of branches to it, it is a group of specialists who give their services freely, them and sometimes their staff members, so that people without insurance can be cared for at the specialty level. And so all of their time is free, but the supplies, tools, instruments, things that might be needed in carrying out those specialty visits are covered in some other fashion. And part of it, as you've said, the hospital district has really stepped up. But you also have a foundation, and usually that invests some fundraising as well. So tell us about that.
Well, let me give you an example first of how We Care fills the gaps in the continuum of care, if you will.
Okay.
All right. So Mr. Johnson, made up name, goes to TCCH and is diagnosed that he needs hernia surgery. Okay. He's referred to We Care. We get an appointment with a surgeon. She sees the patient and finds out that he's homeless. So she says to We Care, we're not going to do the surgery until he has a place to rehab.
Makes sense.
So that makes sense. Going back to the woods is not a good place to rehab.
Right.
So We Care then arranged for him to stay in a local motel for a month, paid for his transportation back and forth to the doctor and for his rehab and all of his meds. So that at the end of the month, his hernia problems were over. He was in better health. That didn't change his life situation, if you will.
Right.
So when you think about a motel, even though they gave us a good rate, 30 days in a motel and all those related expenses is expensive. And that's where the We Care Foundation comes in.
For those special, unusual circumstances.
Right.
As well as the routine things, like when you were talking about dermatology, I was thinking about scrapers and things.
There are all of those things that, as a non-medical professional, I don't know what those are. But we have now through TCCH a great way of ordering supplies and materials that will get there in a couple of days at a good price. So we didn't have that before, so that's been a real advantage.
Well, I'm glad to hear that. Yeah. Besides the fact that, again, from a continuum of care point of view, we were sending a lot of referrals to We Care, and yet from an individual's perspective, it was 2 really separate organizations that didn't necessarily communicate in the way that we can now. And so
We Care gets referrals from primary care physicians. Someone can't just walk into We Care and say, I want to be a We Care patient. Okay. We've had very ingenious patients, though.
Creative.
who have gone into doctors' offices and said, we're We Care patients and we want services. And they got the services, and then they contacted We Care.
Whoops.
And so we then have to go in and meet with these folks to make sure that they're eligible, which meant in the last 2 months, Nurse Angela and I have been to people's homes. We met them at doctor's offices. We've met them at McDonald's.
Wow.
Right, to make sure they were eligible. But we don't want, that's not the best way of becoming eligible. Okay.
Yeah.
The best
way is through a primary care provider.
Correct.
Who can look at the big picture and then communicate the complete needs.
So we typically then get a referral, not only from TCCH primary care providers, but also from whole family and from private practice. But I'd say right now, about 75% of our referrals come from TCCH. And that's why this was such a good partnership for us.
Well, and we're grateful for all of the providers across the entire county who are seeing people that are uninsured. And it's nice to know that there is that continuum of care, because there's nothing more frustrating than being in a position of saying, I can't help you anymore. Yeah. Okay. I know you need more, but I can't do it.
And the good thing is we have a lot of very generous people, philanthropic people who give their gift of service and don't even contact We Care. They just are doing it and have done it for years.
Absolutely. So thank you guys.
Yes.
And gals.
Yeah. And as well. So, but then.
So how do you fundraise then?
The We Care Foundation was founded, I think about 10 years ago, to raise funds. And so every year we had one fundraiser called the Mardi Gras, and about 150 folks came. It was our way of thanking our doctors.
Whoops.
So, and that I should have shut my phone off before. It was our way of thanking our doctors. So our physicians were invited to the Mardi Gras with a guest at no cost.
Ah.
All the regular people had to pay $150 a ticket. But then these wonderful physicians and their staffs would then make a donation to the foundation afterwards. So every year we could pretty much count on raising about $100,000 from the Mardi Gras.
Wow.
Which covered pretty much all of our expenses. During COVID, we got a Mardi Gras in just before COVID really
I remember that.
And then we had to postpone in 2021. And then in 2022, just this past March, instead of a Mardi Gras, we did a celebration of 30 years of We Care in honor of Dr. Dennis Saver, our founder, who was this past year recognized by the American Medical Association as the Volunteer Physician of the Year. He received that, unfortunately, posthumously because he died in July of 21. So it was a celebration of We Care, a celebration of Dr. Saver.
And all of his efforts.
It was. And so we raised pretty much the same amount of money we would have raised if it was Mardi Gras. But this year, Mardi Gras is going to even be bigger and better, because the more money we raise, the more patients we can serve, the more we can help.
And it is open to the public.
It is.
Okay.
There'll be articles in local paper announcing it.
Okay.
All right.
Great.
And again, I'll give some phone numbers later for people.
Well, later is just coming right up here, Robbie.
Okay. And let's start right now.
Okay.
To find out any information about We Care, you can go to our webpage. That's really pretty easy. It's wecareofirc.org. And for the Medical Society, it's ircms.org, or Indian River County Medical Society. And if you are in need of We Care services, you should see a primary care physician. But if you have questions, you can contact our nurse advocate, Nurse Angela, and her best number is 772-257-3146. In all the information about all of our fundraisers, about our physicians who volunteer, our new doctors on the Medical Society. We have pictures of all of our new doctors.
Wonderful.
And
wonderful.
So, and a little blurb about their practice.
That's great. You know, we are so appreciative of all the efforts of the wonderful people in this community to care for those that are a little less fortunate in how life has turned out for them at this particular moment. But as you say, when you get healing started, you can move on to other things. So thank you for all of your efforts, Robbie. And
You're welcome.
And thank you all for being with us. And we'll see you next week.